San Joaquin County is the 15th most populous of California's 58 counties, with 750,000 residents. San Joaquin General Hospital is a 197-bed general acute teaching hospital that serves the residents of San Joaquin County and Stockton, California. Using a multidisciplinary approach, the hospital provides chronic disease management for a variety of complex conditions. One of these conditions is heart failure, for which San Joaquin General offers a CHF clinic embedded in its primary care clinics that fosters collaborative, team-based care. The American Heart Association reports that about 5.7 million adults in the United States have heart failure, costing the nation an estimated $30.7 billion annually. The heart failure death rate in San Joaquin County exceeds both the state and national rate.
Here at San Joaquin General Hospital, we experience the same escalating prevalence and challenges in heart failure management as it is true nationally. Despite having a traditional specialty congestive heart failure clinic, during a 12-month period of this study, our readmission, length of stay when admitted, and the number of ED visits for our heart failure patients increased, while utilization of the clinic by our heart failure patient actually declined. We saw the opportunity to improve, and we acted on it. 7 out of 10 pivotal issues addressed by the 2017 American College of Cardiology Expert Consensus paper for the optimization of heart failure involves addressing the challenges of care coordination, improving adherence, managing comorbidities, integration of palliative care, and transition to hospice care. Our previous heart failure clinic was not designed to address these issues. Our aim was to engage and, more importantly, empower our patients to improve their health and try to make care not only more accessible, but more convenient to our patients. To achieve this, we started with the following. We co-located our clinic in FQHC, where the majority of patients' visits happen. We began working closely with our transition of care team and made every effort to schedule an appointment within 3 to 7 days post-hospital or ED dismissal. Our nurses and pharmacists made addressing the patient's issue an absolute priority by utilizing an easy-to-reach centralized phone number and portal messaging system. At the same time, engagement of our local medical managed care plans was also virtually important for this project. We reached out to them soon after the program was in place, and their support in providing self-management tools such as blood pressure cuff, weighing scales, and wearables for their patients in this program was vital.
In our standalone specialty clinic, we never really had the time, the resources, or the expertise to address all these barriers that were preventing our patients from effectively managing their disease. We were focusing just on the medication management and not really addressing the transportation, substance abuse, and housing and food insecurity issues that were preventing our patients from complying with their treatment. I'll never forget the first time I met Mario. He was in the emergency room. It was probably his 4th or 5th time there. He would be out of the hospital, back the next day. So I finally went to him and I asked him if he wants to just try coming to our clinic, see if he can break the cycle. And I asked him, what does he really want to do? What's the one thing he wants to do? And he told me he just wants to take his kid to the park.
We ensure our patients are on the most appropriate guideline-directed medical therapy and understand the importance of taking all their medications appropriately.
Our heart failure team found that despite relatively limited resources, our multidisciplinary team embedded in a primary care setting is a highly effective approach to complex heart failure care.
Patients are more engaged and satisfied with this approach, and demand for services at our heart failure clinic continues to increase. Patients with at least one visit to the heart failure clinic during the period August 1st, 2017 to July 31st, 2018 experienced a 35% reduction in ED visits, a 67% reduction in hospitalization, and a decrease in average length of stay per patient of 68%.
Based on the program's positive results, we plan to expand access through a combination of leveraging available technology and broadening programs' eligibility. Engaging the local payer to assist in providing Bluetooth-enabled wearable, telemedicine, e-consult, and virtual care will significantly improve access to remote population.
As nurse care managers in the CHF clinic, we provide one-on-one education to our patients that stems from a whole-person care approach, which includes heart failure education while addressing socioeconomic determinants.
We provide blood pressure cuffs and scales and educational handouts. We assess their insurance needs, coordinating with the patient service representatives and the on-site Medi-Cal office for financial screening.
In addition, we are nurses in transitions of care. We contact patients who are transitioning from the inpatient and outpatient setting and assist them with navigating our healthcare system. Many of our patients have had great success with our treatment program and have graduated our clinic, just like Mario, who was excited when we told him that he could ride the roller coasters with his family. We look forward to continued success and serving the population in our community.
The redesigned, multidisciplinary congestive heart failure clinic at San Joaquin General has reduced heart failure hospital and emergency visits. San Joaquin General Hospital's team approach to heart failure management follows the hospital's mission of providing optimal, compassionate care to the residents of San Joaquin County.